So this woman obviously has had multiple plastic surgeries.
I think the most striking thing about this lady is her eyes, and the angle of her eyebrows has been altered so that the inner part of the eyebrow is so much lower than the outer. That goes along with the slant of her eyes, which also has been altered to make her look like a cat. So when you look at her face, it's probably her eyes that really are the most different from the general population and makes you think that she's had something done to her face, which is odd and different and honestly not really all that attractive. It's really quite sad because she was a very pretty lady before, and a lot of the surgery that she had appears to be unnecessary. But I think the strangest thing is whatever has been done to her eyes, which probably includes a brow lift, a lateral canthoplasty, which is shifting the position of the outer corner of the eye, upper and lower eyelid lifts, and just really changing that slant of the eye into that sort of cat eye procedure look that a lot of patients are asking for. This is a very extreme example of that, which is, in my opinion, gone very wrong. Is an example of what patients will bring to me and say it's bad plastic surgery and they don't want to look like this. The other things that have happened look like she's had a very distorting facelift procedure. So she has what we call in plastic surgery a lateral sweep, which is sort of upward and sideways unnatural contour and position of her face that just looks like everything's been pulled too much and too far and in a very unnatural way. In her before photo, she really looked quite youthful, and her cheek and her jawline, her lower face were all in a very natural, normal position. And even though her cheek is higher and her jawline and her lower face might be tighter, it looks very unnatural. Just by tightening things, you can't really make someone look necessarily better, and this is a very good example of that. Some telltale signs that we shouldn't operate on somebody is somebody who's really gone through emotional loss or emotional distress, or just is not in a stable, happy place for surgery. That's something that we really want to tend to avoid. And if somebody tells us that they're going into surgery having gone through something that's been very emotionally, psychologically difficult for them, I just don't think it's a good time to undertake something major like a surgical procedure. The other situation we see is that when a patient wants something that we feel is unachievable, unattainable, out of the ordinary, or they're fixated on a feature that I feel isn't really as important as they're saying. Those are also other signs that possibly a surgical procedure isn't going to be right for them, because we feel that those patients will probably never, ever be happy, even with the perfect surgical result, no matter what we do. I think in this case, if a patient came to me and looked great like she did and she wanted to look like someone or something else, I think that is a clear warning sign that maybe something shouldn't have been done. In her case, she really looked quite beautiful before, and for her to want to look like something else, I think that's a bad sign. I think, reasonable request is if she was older than she was in her first photo, in her before photo, and she wanted to simply look like how she did when she was younger, I think that's a very reasonable request, and there's nothing wrong with that, and that's something we can definitely offer patients. But to want to look like a cat is, in my opinion, not really a great thing to do for someone. So even though this is an extreme case of plastic surgery that, in my opinion, has gone wrong, plastic surgery can be very natural, can be very beautiful, very life-enhancing, improving people's lives for the better, and it totally doesn't have to be this way. So thanks for watching. Please give us a like down below, drop some comments, and subscribe to our channel. We'll see you next time. Thank you.